My name is Dr. Angela Erdrich. I'm a pediatrician. I'm an enrolled member of the Turtle Mountain Band of Ojibwe, and I've been working in Native American communities for 15 years. And I'm particularly interested in educating my patients and families about the most up-to-date methods of birth control available. At the Indian Health Board in Minneapolis, we're very sensitive to cultural issues. We realize that people may have certain cultural beliefs or family traditions, or they may need to speak with their relatives or their mom or an elder before making decisions. Our job is just to offer them the information and offer it in a consistent manner that is standard of care for the whole country. I have sometimes found that in working with Native people, the newest methods may not be available, or people may not have access to all the information that is available out there. The American College of Obstetrics and Gynecology came out with a really powerful statement in 2012 that had to do with adolescence and long-acting reversible contraception. And I'm proud to say that in our clinic, we are up to date on all of these options, and we have a nurse practitioner who's really good with young women, and she's able to offer those methods.
My name is Amy Langenfeld, and I'm the certified nurse midwife at the Indian Health Board. I am a nurse practitioner who specializes in women's health, pregnancy, labor, and delivery. There are a lot of birth controls in the market that are available for women in all different stages of their life. And so what I really want to do today is just give you the accurate information that's available. And if you have any questions, please let me know, because there are things that we hear from our families, from our aunties and well-intended others, that just sometimes is not the most accurate information. The one thing that we know about birth control is that the more often we have to remember to use it, the less likely it is to be effective. The ones today that I want to focus on are the ones that last quite a bit longer. The IUD is very small. It's not much bigger than a quarter. There's one with no hormones, and then two other types with hormones. 10-year option, 5-year option, and a 3-year option. So you really can kind of think about what's right for your life. Now, we talk about 10 years, 5 years, and 3 years. The important thing to know about that as well is that you're in charge of when that is placed in your body, and you're in charge of when that comes out. Mm-hmm. No medical provider would ever force you to keep an IUD for 10 years if it's something that either is not working for you, or you're not uncomfortable, or your plans have changed and you'd like to have a baby sooner. The smaller purple-colored one here now is actually just being released for younger women who have not had children.
How long does the procedure take to insert it?
Oh, excellent question. The procedure takes about 5 minutes. Most of the time is actually spent cleaning the vagina and cleaning the cervix, which is the opening to the uterus. The actual putting of the IUD into the uterus is about, I would say, about 30 to 60 seconds. And you will have some cramping after it's inserted, but that usually goes away within minutes to hours. And most women say it's not much more cramping than their menstrual period would be.
Check it out.
Do you guys want to touch the IUDs, and you can see how flexible and pliable they are? And they move really well with your body on the inside. So the other method I want to talk to you about today that's a long-term method is the implantable product. This is actually what it is: a small plastic rod. And I'm going to pass it on so you can feel it. If we wanted to, if my fingers weren't so big, we could actually tie this in a knot. It's so soft, okay? This releases a tiny, tiny bit every day, but it's such a small amount that there's enough in there to last for 3 years. What we do with that is we place that into a woman's arm, and right between them there is a little groove. Every woman has it, and there's a little bit of fatty tissue in there. And so what we'll do is we could put some Novocaine into that space, numb your arm up, then with a special applicator we could put that implant right into your arm, cover it with a bandage, and you have birth control for 3 years. This basically tells your body that it doesn't need to make or ripen eggs for fertilization. So this does not interrupt egg and sperm getting together. This interrupts the egg being released at all. When you're ready to have that removed, what we'll do to get it out is to numb that space up again. Make a tiny little cut and grab it with some tweezers and pull it out. None of these methods are going to give you any protection against sexually transmitted infections, and so that's really important to know that you'll still need to use barrier methods to protect from that. These are not the only two types of birth control that are available to women. There are many, many options, and I have a little graph of those for you. It's nice to know that we have all of these options so that you can talk to your health provider and they can talk to you about what fits your life the best. Contraception is a very personal choice, and it's just really important that women get to know what their choices are, know what their options are. There's one more method that I think it's really important that we talk about, and it's not even really a method of contraception. It's actually called emergency contraception, and what it is the morning after pill. It is effective for up to 5 days after unprotected intercourse or another birth control failure. The sooner you use it, the more effective it is, and it can be up to 90% effective. All of these contraceptive methods that we talked about today, we offer at the Indian Health Board, including emergency contraception. What's most important for us is that women have access to care, so couples can choose what's right for them. If you ever have any questions or worries, you can always make an appointment to come in and talk more about this with one of our healthcare providers, including myself, or if you're unable to come into the clinic for one reason or another, you can call as well, and I'd be happy to talk with you on the phone about general concerns that you would have.
Thank you.
Thanks.
At the Indian Health Board of Minneapolis, we are used to uninsured patients or patients who may not know what their resources are. So we have a benefits coordinator whose entire job is to figure out how people can pay for their care or find a program that actually covers the care. And there's a program called the Minnesota Family Planning Program, and the vast majority of our patients can be covered by that, so there's really no cost to birth control. What we're really trying to do here is to help women plan for their pregnancies, to be as healthy as they can be, making sure they put some thought into their goals in life and how having a child fits in. Native American women are achieving so much through education, vision, leadership. A lot of young women have goals and aspirations, and sometimes birth control helps people not get derailed on their goals, helps them achieve what they need to achieve, and that helps the society overall and helps Native American communities, helps us grow stronger.
Before I have children, my interests are to just travel as much as possible and eventually get back into school. But first now, it's just about traveling and meeting as much people as I can and networking and finding more about what I want to do as a career. And I do find myself wanting to have children in the future, but definitely way after I have my own personal agenda taken care of. I feel like the Indian Health Board is really, it protects your privacy, and they are very open-minded to any questions you have.
I do not have children yet, and I've been going to school for a long time. I'm working toward a doctorate in psychology. So my goal is to graduate and finish graduate school and then have children. I think it would be pretty difficult to do both at the same time. But I am very excited to have kids as well. So it was good to hear about sort of the different options with timelines and the various kind of ways to go about that.
Right now I am in school to become a registered nurse. I have 2 children, ages 6 and 4. And so going to school and having kids, it's been rather difficult. Time-wise, it's not the easiest thing to do. So I love my children, but I think that I would have been better prepared if I had given more thought into planning, family planning. I think awareness is something that we need in the Native American community regarding contraception. I don't think there's enough education out there on it, so I just want people to know that you have your whole life ahead of you, so it's good to be prepared now and consider that.
Every woman really needs to decide for herself what's right for her. And it may be that she has really significant people who have cultural or family influences on her, and she will need to talk with those people before she makes her decision. But we can at least offer education and talk about the risks and the benefits. It's almost like we're in a historical era of birth control, a modern era where we're getting closer to the ideal, which is really effective methods of birth control with lower side effects that are long-term. You don't have to think about them as much. And they're now even available to women who've had children, women who are spacing their babies, and to women who've never had children at all. To some people, maybe it's kind of like a new idea that you can plan something that's so huge, almost like a miracle, that the beginning of life, that you can be so deliberate and plan it. In the medical profession, we promote that, the idea that, prepare your body, prepare yourself for pregnancy. And education is power, and we can help these young people make the best decisions for their own health and the health of the future generations.